Hello, welcome. This is our second webinar of the year online. This one's our informal in conversation with Putney Nurses. Just would like to thank you for joining, and I'll pass over to Claire, who is our head of nursing, and she'll be able to introduce each of our panelists, and she'll be facilitating the webinar. Thank you, Claire.
Thank you, Anna. Good afternoon, everybody, and thank you for coming along. It's a little bit strange doing these things on Zoom. It would be nice to be sitting and seeing your faces. So it's all a bit strange at the moment, isn't it, with COVID and everything?
It is.
Yeah, so we're nurses at the Royal Hospital for Neuro-disability, which is located in Putney, southwest London. We've been on this site since 1862, which is 157 years. Prior to that, it was in a different location, so there's a long history that goes alongside this hospital, which I won't go into for this webinar. Queen Elizabeth is our patron, and we are a charity. So a little bit about myself. I've been in nursing, predominantly in the NHS, for around 34 years, and my background is critical care and emergency care trauma. So coming to Putney is quite different, but it's also very much the same. Wherever the patients are, whatever type of hospital you're in, they're still patients. But what's different about this hospital is how highly complex and unique our patients are. So nursing is incredibly challenging and very, very interesting in this hospital. We care for patients who have significant neuro-disability, for instance, are caused by neurology, neurosurgery, trauma, road traffic accidents, assault, stroke, Guillain-Barré, motor neuron, and many others. All of the disabilities caused by their brain injuries are incredibly life-changing, not only for themselves, but for their families and loved ones. So it's very, very highly complex and very delicate nursing place to work. So our patients are all incredibly highly dependent and very complex, as I've said. It's literally the ultimate nursing experience. Just to put it into some context, in the hospital we have 237 beds, we have 12 wards, we have 144 tube-fed patients, we have 58 patients with tracheostomies, and we have 16 ventilated patients. We have an army of therapists that work alongside the nursing team. We have OTs, SLTs, physios, we have music therapy, we have psychologist support, we have doctors, we have wheelchair experts, we have a lot of IT to help with communication and volunteers. So it's a really very strong multidisciplinary team, completely focusing on the benefit of our patients and to give them the best life that we can. We also focus on rehabilitation post-brain injury, and we have a very acute 3-month service for patients with brain injuries. And I'd just like to give a little story about what sort of led me to this hospital. As I said before, I've worked in critical care, and a lot of my patients would be eventually discharged from critical care and would go to Putney Hospital in London. So I got quite curious about that, and that's when I sort of started to explore what Putney did. And one of my patients recently, so I've been in the hospital for 10 months, one of my patients recently who I cared for, literally as they came off the helicopter into the resus room in A&E, into critical care, he went to Putney before me. I came to Putney after him. So I saw the whole journey from the initial impact of his brain injury, and then I saw him walk out of Putney with a big smile on his face. So what this hospital does for our patients, I've got goosebumps, is completely extraordinary. So I just wanted to give you a little bit of context around this hospital. So I've carefully, I would like to say people have volunteered. So they've been carefully selected to give a little bit of a cross-section of nursing in the hospital. Unfortunately, Harleen hasn't managed to join us yet, but hopefully she will. So she's one of our band 5s in the continuing care side of the hospital. We've got Caleb, who's a band 6 on the brain injury service side of the hospital. We've got Lynn, who's the band 7 ward manager in our specialist behavioural unit, and Justin, our matron, who's in charge of the ventilator units and young adults units. And lastly, but not least, we have Louise, who's part of our incredibly talented team of CNSs. So I think it might be nice to hear from Caleb first. So the floor is yours, Caleb. If you can just tell us, how does it feel to work in this hospital, and what does it mean for you as a Band 6 senior nurse?
Thank you, Claire. So working in RHN is a special place to be. As part of my role, I work in the brain injury service where we do the rehabilitation. So we have patients ranging from immediate post-acute, where they come for assessment and they get pathways onto which pathway they'll be going to a level 1 rehabilitation ward. And I'm currently working on a level 1 rehabilitation ward among a multidisciplinary team. And as part of my work as a Band 6 and as part of the nursing team, our work, most of the patients coming here are coming for rehab or coming for a directed pathway into their recovery process. So we work on the medical side to make sure these patients are medically stable or their medical interventions keep going to make sure they are ready to go through their rehab process, they are ready to go through their daily activities. And we form a very focused part of the care we render in RHN, because if our patients are not medically stable, we can't render these rehabilitation services we render to them. So we form a very pivotal role in what we render to our patients. And I must say, working in RHN, this is very special because you get to see patients who come into our department as a brain injury service where they have high level of dependency because they've just been stepped from ICUs into our wards. They have tracheostomies in situ, they have a PEG tube, they are not talking, they are not mobilizing, they are full hoist. And at the end of their rehabilitation period or at the end of their stay, they walk out of the door on their foot. They chat with you, they read books with you, they have intellectual conversations with you, they're able to eat. And I must say, it is very, very inspiring. Not until I came here, my background was purely in A&E and trauma. So I didn't see what happened to our patients after we stabilized them. But so I was curious to join this hospital. And when I came and I realized the incredible journey in this hospital and the communal relationships among patients and staff, staff and relatives, I realized it is a very special place. And if you're hoping to see best quality care, RHN is one of the places to go as a nurse and give you a very good perspective of what life is for you now whilst you are capable, and what life will be for you when you are disadvantaged, and the journey through it, and the incredible people you meet along this journey to see you through. So that has been my experience so far in RHN and the departments I work in.
So Caleb, can you tell me, what are you particularly proud of?
In RHN, there's a lot to be proud of. What I'm particularly proud of is the communal nature of the work environment in RHN here. You work along with a lot of multidisciplinary team members, and you get to see the physios, you get to see the doctors, you get to see all the admin and domestic staff, and there's a very fine connection between this team. It works like magic. When you need them to be there, they are there to help you. And also the level of senior leadership. Back where I worked in trauma for almost 8 years. You hardly see your CEO, your head of nursing come into your department. But in RHN, when you need that support of the director of nursing or the head of nursing or from the medical director or from the chief executive, you will have that support. And another incredible thing in RHN is they invest in their people. As part of the values in RHN here, one thing, I've been here for 2 years, and what I've realized is they deliver on their promises. One of our values is we see the whole person, and one is we deliver on our promises. And those promises is to invest in the people working here to make sure they are ready. And trust me, RHN goes through that process with you when you want to go through that journey and develop your career and build a very good career. So I'm very proud of these values. There's more to say, but I'm sure my other panelists will be ready to share more on these things.
Okay, thank you very much, Caleb. So I might bring in Lynn now, because Lynn, you're relatively new to the hospital, and you've come in as a Band 7 ward manager for the behavioural specialist unit. Can you just describe how it's felt for you to come into what we call our work family and our very specialist hospital?
Yeah. My name's Lynn. I am actually a mental health nurse by background, and I started with the RHN in January of this year, and it was on a 3-month contract with a view to becoming permanent. So when I started at the RHN, the welcome I got was unbelievable. I had met with you, and I'd met with our Director of Nursing and the Chief Executive Officer within the first week of arriving, and I felt really welcomed and really supported. So I had a really nice start. And even though I was coming in as someone from an agency to sort of hold the fort, try to build up, I had in the back of my mind it was the place I wanted to stay. So I never came in with the view that, okay, right, this is a job that needs to be done. I literally thought this is somewhere I really want to be part of. And I remember having a conversation with you about 3 weeks into that contract saying, I really want to stay here. And you saying to me, yep, it's a really good place. Carry on. We'll see what we can do at the end of it. And I'm now a permanent member of staff. I'm incredibly proud to say I work at the Royal Hospital for Neuro-disability. Incredibly proud. You know, it's one of those things I will shout from the rooftops because of the incredible job that I see day to day being done, not only on my ward, but in the hospital as a whole. There are some of the things, especially one example is the COVID crisis. I think this has been managed so well within our hospital because there is such a sense of community and a sense of we will get through this together. And I've never felt anything like it. It's just an incredibly special place to work. So that's my journey. I'm here for 6 months. I've got my feet under the table. I feel very happy where I am. I've got an incredible team of therapists, healthcare assistants, nurses. You know, everyone has their part to play, and they all literally work as hard as they can for the patient. And I just think it's a great place to work. So
Thank you very much, Lynn. Could you tell us a little bit more about the patients that you look after in your specialist unit?
Yeah. So I work on the neurobehavioural ward. Our ward is specifically for people who have behaviour challenges. It may be they also have very complex communication needs. So it's sometimes very difficult for them to communicate what is actually going on for them. And that comes out behaviourally at times. So our goal, whenever we have a patient who comes to us or who is referred to us, we think, what can we do for this person in order to improve their quality of life and be the best person that they can be? And what do we need to put in place in order for that to be achieved? And I mean, one example of that, we had a young man who's since been discharged, but one of his goals was to be able to walk. By the time he left our ward, I remember the first day he walked around the ward, we actually managed to video it, and we sent that video to both yourself and Emily. And that, I get goosebumps about that. He was actually able to walk out of the ward to his next home. So, you know, that is something that I just think is unbelievable. It seems like something simple, but you know, all the hard work behind it to achieve that goal for that young man. And when his mum first saw him, when he stood up and walked to her, she was in tears. And it is just an incredible thing. So, yeah.
Yeah, thank you for sharing that, Lynn. It's just a testament to the hospital, the amount of effort and time and work that goes into helping our patients to be the best that they can be with their brain injuries. Thank you very much. So I think I might go to Louise next. So Louise is part of our clinical nurse specialist team, which is a fairly new team. It's been in place for about 3 years, and we've got, I think it's 8 clinical nurse specialists in the team. So Louise, would you like to tell us about your team and a little bit about your specific specialty?
So yes, you're right, Claire. We have a team of 8. My actual specialist role is as the enteral nurse specialist. So what lots of people might not know is that the RHN has got the largest number of enterally fed patients in the UK under one roof, possibly in Europe. So it was no small thing to come to the RHN doing what I'm doing. And I couldn't believe that this job was even available. So I've been with the RHN now for about just over 18 months. And the first day I walked in the building, I just couldn't believe everyone was smiling and laughing and was so friendly. And you just don't get that anywhere else. Certainly at the time I was working in the community and going in and out of NHS trust hospitals, and you certainly didn't get lots of smiles when you walked in the door. Everyone was quite stressed. So it was just a breath of fresh air to walk in. From my perspective, my role involves two parts really. There's the educational side as well as the clinical side. So I'm responsible for all the training of all the staff, patients themselves, sometimes families and carers, just to make sure that they know what they're doing, that they're able to look after their feeding tubes, that they can sort their pumps out. The other part of it is the clinical side. And as you've both alluded to, all three of you have alluded to, our patients are very, very particular. They have certain complex needs. So it's not one size fits all. And what's so great about working at the RHN is I can really look and work with that patient, and we can look at what fits that patient, what's right for that patient. And I can just keep going until we get the answer. And perhaps in other trusts and other hospitals, you don't have that freedom. You're bound by contracts, etc. So it really is about the individual care given to that person to make whatever it is that they have, make it work well, make it work the best for them. So just one story, one example was a patient that we had with complex injuries needed a tube change. And we worked out quite quickly, I realised that it wasn't really appropriate to send him to an acute hospital to have that done. So talking with colleagues, we were trying to work out how best we could do it. And I had a conversation with the dentist of all people. And we decided that actually this patient also needed a dental checkup and would be sedated for the dental checkup. So I was able to sit with them and plan a tube change. We sedated the patient, I did the tube change, and then he had his teeth sorted. So that just would not happen anywhere else. We planned it, we spoke to the relatives and family and told them what we wanted to do, because the patient himself didn't have the capacity to make any decisions. But it was very quickly planned and it was arranged. And it's just, the RHN is so unique in that we all look at the patient and what can we do for them. And we're always working out how we can best achieve that. And it can come in the most unlikely of places.
Yeah, thank you, Louise. You really thought out of the box for that. So we do have a particular amount of freedom in this hospital to, you know, as a team with what we do to get the best we can for our patients. And within the CNS team, we also have continence nurses, infection prevention and control, education, end of life. There's so many, tissue viability. So we've got a whole suite now of clinical nurse specialists, which are absolutely vital to make sure that we give the highest standard of care we can within each of the specialities. So Harleen, thank you for coming. I forgive you for being late. I understand you had a few troubles getting online. So Harleen, she's at the bottom of my screen here, is one of our Band 5 nurses who works in the continuing care side of the hospital. So this is our specialist nursing home. So the wards that Harleen works in are the patient's home now. So Harleen, how does it feel to you to work in this hospital?
So I've been in 9 months here in Royal Hospital, and the very first thing that I've experienced in the hospital is the very welcoming environment since I came here, and the support that they have gave me, especially during the OSCE times. And I believe that helped me a lot throughout my transition here in the hospital. And I didn't have any experience in rehabilitation wards before, or even in long-term care, because I've had nursing experience back home in intensive care unit, and I've worked in Singapore as well in the surgical ward. So I didn't have much experience in rehabilitation or long-term care wards at all. But I'm very thankful for all the help of the staff throughout my transition here. And yeah, I can say that nursing in Royal Hospital is really complex, and it's unique compared to other hospitals. And when I first came here in the ward, I was amazed on how the staff were able to communicate to patients despite of their neuro-disability. And later on, I did found out that we have these very special care plans to each patient, and they have a special communication passport as well. And it's very helpful. And just one day, it was like magic that I was able to communicate with my patients, even in their neuro-disabilities.
Yeah, thank you, Harleen. It's totally individualized and holistic,
Yeah.
isn't it? Every
Yes, it is.
is completely unique. Yes.
Yes.
So how does it feel to work on a ward in the hospital where it's our patient's home?
Sometimes I get to get in touch more with my patients. So as I will compare it to my hospital experiences before, I didn't have much time to interact as what am I doing here in the long-term care. And it's very helpful. I can see that my patient has been improving, even if they have been staying here for a long time now. But from day to day, I can see that they are very improving. And when relatives comes, it's very overwhelming that they've been thanking us very much for taking care of their relatives so well.
Yeah, thank you very much, Harleen. I think we'll all agree that neuro rehab, we need everybody, the relatives, the patients and ourselves. We need patience.
Yes.
We never to give up. It's very slow process, but it's worth it, isn't it? Even for
yes,
that
it is
slight
very worth it.
Yeah, thank you very much, Harleen.
You're welcome.
And lastly, but no means least, I will go to Justin, who's our matron for our ventilator unit, soon to be units, plural, and our young adult service. And Justin, I'd like you to just give us a little bit of a flavour of what sort of initiatives we've done in the hospital in recent times, and also the focus on leisure and making sure people are having fun and living their best lives.
Absolutely. Well, as you said, I oversee the ventilator unit and the young adults units, and we are soon to increase our capacity in ventilation by opening a second ventilator unit and also caring for people with high respiratory needs. Really, our focus here with ventilation and complex young adults who can't safely be cared for in the community is around safety. And we find that once we can create a safe environment, that's when the fun starts, really. And our focus becomes about quality of life, accessing the community, which for you and I is a very easy thing to do. But when you're reliant upon a ventilator, it becomes a lot more complicated. So there's been lots of initiatives to improve the environment of the ventilator unit to make it much more sociable, much more fun. The patients and the staff did a fundraising campaign to improve their garden, and they spend lots of time in the garden barbecuing, and that's a recent favourite. We also just try and bring the hospital together, so people meet each other from different areas, different patients from different areas of the hospital with very different needs, socialising in the communal spaces and also the gardens, which everybody loves during the summer. Really, I guess just pushing into what I'm really proud of in the RHN is its creativity. It's such a creative environment, both for the patients and for the staff. And I think that's something that's very, very special. And when you are able to create in what you do, usually it brings great things for everyone involved.
Would you like to just touch on some sort of recent initiatives that we've done at the RHN, which have made a big difference to our patient experience and avoiding admission to the acute hospitals?
Yeah, so traditionally, the Royal Hospital for Neuro-disability has transferred any patient who becomes acutely unwell into an acute hospital. Recently, and in a large part due to the COVID-19 crisis, we've been caring for acutely unwell patients within the hospital. So we've set up a clinical response service. We've rolled out intravenous therapies and increased our formulary across the hospital. So that's not just the ventilation and the specialist services, but also in long-term care. So what we found is that our acute admissions have fallen from, I think it was 25 to 30 a month, to now just a handful. So what we're able to do is keep people in their home, and we're finding that they're recovering from illness much more quickly. And it's certainly, when the families are able to visit again, I think that's going to be a benefit they really see.
Yeah, thank you very much, Justin. Thank you to the panel. So I'm going to go to the audience now and ask for any questions.
No, so we've got I've got a couple of questions here. Firstly, to do with working at the RHN. How can I apply for a job as a nurse at the RHN?
If you want to apply for a job as a nurse in the RHN, it's very, very simple. You just need to send your CV to our recruitment department. So we can take direct CVs and organise interviews if shortlisted, and also to keep an eye out for any adverts we have. We advertise on the NHS jobs.
Okay, thank you. And also, what types of jobs are available?
At the moment, we have openings at healthcare assistant level and at band 5 level. We're fully established at band 7 level and the matron level at the moment. We will have some band 6 opportunities coming up soon as well. So there is a lot of opportunity within the hospital.
And I've got one more question here. How can I volunteer at the RHN?
So we've got a really good volunteer service here. We've got a new lead called Emma, and it's the same sort of process. Just put in your CV, have an interview, get all the checks and balances sorted, and people can volunteer in this hospital as little or as much as they want to, even if it's just 1 hour a week. We're very, very grateful for all of our volunteers and the difference that they make to us and our patients.
Thank you. I've got one more question. What are the learning opportunities at the RHN for nurses? Sorry.
I'll pass over to Justin for this one, if I may.
Yeah, so thank you. One of my areas of responsibility as a matron is overseeing the education of our clinical teams. So that includes nurses and healthcare assistants. We're very much about empowering our workforce, particularly from a healthcare assistant perspective at the moment. Opportunities, we have in-house opportunities for training. So we have courses such as cannulation, phlebotomy, management of deteriorating patients, lots of clinical skills, which is closely supported by our clinical nurse specialist team. And we also support people outside the hospital to achieve any personal aims. We have nurses who are completing master's level study. We have nurses who are looking to complete PhDs. We also have a very active research department that are looking to support them through that. So really, there's just lots and lots of opportunities for development. Having come from a larger hospital to a smaller hospital, I found that the answer has very rarely been no.
Thank you, Justin. Thank you for filling us in with that. Any other questions, Anna?
No, I think that's all our questions. So I'd just like to thank everyone for joining us today. Thank you to all the panelists. We really appreciate your time. I know you're all incredibly busy. And thank you, Claire, for facilitating us.
It's been my pleasure. Thank you very much, everybody. Have a lovely evening. Bye-bye.
Thank you, Claire. Bye.
Thank you. Bye.